In breast augmentation surgery, what does the term dual plane mean? Well, in general, with breast augmentation surgery, there are two primary planes or pockets that are created for breast implants to reside in. One is a submammary pocket where the implant sits on top of the pectoralis major muscle. The other would be subpectoral or submuscular, where most or a portion of the implant is under the pectoralis major muscle. Now, the nature of the pec major muscle anatomy is such that it is almost impossible to have complete coverage of a breast implant with the pec major muscle. Also, there are some compelling reasons why one should release part of the pec major muscle so that when the pec major muscle contracts, implant position doesn't change significantly. If a subpectoral augmentation is done and there is not adequate release of the muscle across the inframammary fold, the breast implant will tend to animate or jump around when the muscle contracts. This is an unaesthetic outcome and very troubling to patients that have it, so it is to be avoided at all costs. So if you release the pec major muscle, you are creating what is referred to as a dual plane pocket. There will be a portion of the implant in the upper part of the breast, in the cleavage area, where the implant is subpectoral. However, below in the lateral outer quadrant of the breast, the implant will essentially be submammary. There'll be no pec major muscle covering it. If you're having a subpectoral augmentation, you are by definition having a dual plane augmentation. As I said before, there are varying degrees of pectoralis major muscle release that can be performed. Plastic surgeons talk about dual plane 1, dual plane 2, and dual plane 3 pockets. Make sure that your surgeon can clearly discuss with you the nature of the pec major muscle release that is going to be performed if you are having a subpectoral augmentation. It has a major impact on the kind of breast augmentation outcome you'll have.